Hi, my name is Hannah Doty. I'm going to do my presentation on scoliosis. Scoliosis is an abnormal spinal condition which results in a C or S-shaped lateral curve of the spine. In most severe cases, it can also involve spinal rotation as well. Some of the causes of scoliosis, there are a lot of them. One could be a congenital spinal defect. Also some muscular diseases, some pelvic abnormalities or unequal leg lengths, which those would all fall under the category of functional scoliosis. But the most common type is idiopathic scoliosis. In fact, that affects, that is the cause of 80% of most scoliosis cases. And the term idiopathic means of unknown origin. However, there's evidence to show that it's hereditary, that there's a familial link. It affects girls more often than boys. And of idiopathic scoliosis, the most common is when it shows up in adolescence, so ages 10 to 15 years old, usually during a growth spurt. And some of the signs and symptoms of scoliosis, the visual signs, are one shoulder higher than the other, one scapula more prominent than the other, an uneven waistline, and also enlarged muscle mass on one side of the back. And usually to screen for scoliosis in a pediatrician visit or at school screenings, a physician would have the child perform a Adams forward bend test, and that's where they would be able to see some of these symptoms. Also another symptom is shortness of breath if it's very severe. And if one of these symptoms or a few of these symptoms show during the screening, the physician would have the patient have an x-ray to see where the location of the curve is and the degree of severity. And that's used by the Cobb method, is the method used to determine the degree of the curve. And technically, a curvature of greater than 10 degrees is diagnosed as scoliosis. For different treatment options, actually just switched the slide, you can have a brace. Usually if a child has a scoliosis curve of greater than 20 degrees, there are bracing options available. Different options for different types of curves and different severity of curves are available for those children. And usually the braces are required to be worn for 20 to 23 hours out of the day for several years. It usually just depends on when the child has finished growing. If a patient has a curvature of greater than 50 degrees, there are different surgery options available. For adults, some of the surgeries would include fusing the vertebrae together with bone fragments from other parts of the body, as well as attaching rods to the spine. However, if a child that's still growing requires surgery, growing rods are available, which sort of acts as an internal brace and doesn't allow the vertebrae to be fused together while the child's still growing. Really, with scoliosis treatment, it's kind of ambiguous. You just sort of have to watch. And so people with scoliosis, especially if they're still growing, are required to be x-rayed and monitored very closely throughout their adolescence. Physical therapy plays a role in patients with scoliosis, both in strengthening and stretching exercises of the trunk. There are also the use of modalities can aid in pain management, and for those patients that do require braces, the physical therapist can help them with their activities of daily living. And the prognosis is good for a scoliosis patient if caught early and mild. And advances in medical technology have actually led to a DNA test to predict the progression, hopefully, of adolescent idiopathic scoliosis. And it might be able to save a child from worry and the family from the stress of worrying if the child will be able to have surgery or not in the future. Thank you.